Hello, and welcome to Part 2 of the law lecture entitled Provider Status. During this lecture, we will define provider status, discuss what it means for the practice of pharmacy, discuss the different sectors involved in the Provider Status Initiative, discuss barriers to provider status, we'll discuss California's steps to achieve provider status, and finally, we'll discuss the aspect of organizational advocacy where it applies to provider status. When it comes to provider status, we're mainly focused on those key sections of the Social Security Act which determine eligibility for healthcare programs, such as Medicare Part B. In the case of Medicare Part B, under the Social Security Act, there are many healthcare professionals who are listed as providers, namely physicians, physician's assistants, certified nurse practitioners, qualified psychologists, clinical social workers, and certified nurse midwives, just to name a couple. One of the big ones that are missing in this list are pharmacists. Now, when it comes to provider status for pharmacists, what impact would that have on the practice of pharmacy? Well, it could improve access to pharmacist services for all populations. In the case of Medicare Part B, the omission of pharmacists as listed providers limits the Medicare beneficiaries' access to pharmacist services in the outpatient setting. It could also increase the recognition that pharmacist services have value to the population as a whole. And finally, states are starting to recognize pharmacists as providers to supersede the federal ask. And when we think about provider status, we can think about three sectors that are associated with provider status. The first of those sectors being the federal sector, which would include, as I mentioned before, Medicare Part B and the Social Security Act. Those things that Congress can regulate in the federal sector. The second sector would be the state sector. This is where we're seeing a lot of activity recently, with different states such as California getting bills passed for provider status. And the final sector would be the private sector. That would be those third-party payers who are not associated with the federal sector. But for these private payers, we're hoping that the federal sector, the Social Security Act, once that becomes passed, they will also follow suit and approve pharmacist services under their plans. So you may be asking yourself, what are the barriers to provider status? Well, Congress is currently focused on fundamental issues that are related to the nation's spending, of course, and other issues such as immigration, which adds the difficulty of moving a provider status legislation or other legislation that can be used as a vehicle for provider status. Additionally, because of immense financial pressures being experienced in all three sectors, decision makers are focused on initiatives that save money, referred to as savers, rather than those that require new spending, which are referred to as costers. As well, other healthcare providers who already have provider status and bill Medicare on fee-for-service basis may have strong opposition, both in political strength and numbers, to the pharmacy provider status initiative. There already is a very big number of people pulling from a very small pool of money, and so these other providers are very worried that if pharmacists get provider status, we'll be just another person pulling from this small pool of money. Now, on the state sector front, there are numerous states that recognize pharmacists as providers. You may have heard of California recently recognizing pharmacists as providers, but they weren't the first. As you can see here in red, all these states that are here in red recognize pharmacists as providers, with many more states introducing legislation over the next coming years. Now, since California is the newest state to pass a provider status bill, we're going to look at their wording of their law. The governor signed the bill into law on October 1st, and this new law declares pharmacists as healthcare providers. It gives new authority to all licensed pharmacists. It establishes an Advanced Practice Pharmacist Recognition, or APP. It gives new authority to those APPs and specifies requirements for pharmacists seeking recognition as APP. An APP would be able to perform patient assessments, order and interpret drug therapy-related tests in conjunction with a patient's prescriber, refer patients to other healthcare providers, initiate, adjust, and discontinue drug therapy with an order by the patient's prescriber and according to established protocols, and participate in the evaluation and management of diseases and health conditions in collaboration with other healthcare providers. In addition, this bill requires those pharmacists seeking recognition as APPs to have completed 2 of 3 criteria, including certification in a relevant area of practice, a postgraduate residency program, or 1 year of experience providing clinical services to patients under collaborative practice agreement or protocol with a physician, APP pharmacist, collaborative drug therapy management pharmacist, or a health system. The big thing about this bill, however, is that it does not address payment for those pharmacist services. Now, when it comes to provider status, in all 3 sectors, organizational advocacy is a must. And many different pharmacy organizations have been collaborating as a coalition of pharmacy organizations to develop a shared vision of provider status and a strategy for achieving it. The strength of this coalition, according to many, is unprecedented, and it includes the American Pharmacists Association, the American Society of Health System Pharmacists, the National Community Pharmacy Association, the National Association of Chain Drugstores, the American Association of Colleges of Pharmacy, the American College of Clinical Pharmacy, the Academy of Managed Care Pharmacy, and many of the large pharmacy chains. It is very important for these organizations to work together, as there is no legislative ask when it comes to provider status. One of the big moves of one of the pharmacy organizations was the American Pharmacists Association, when in January, the APHA Board of Trustees pledged $1.5 million to the cause of achieving provider status to ensure patient access to pharmacist clinical services. The initiative seeks to optimize the medication experience and wellness of all patients. You can keep up with the latest news on provider status through the APHA website at pharmacist.com. This concludes our lecture on provider status. Now what you need to do next is on Moodle, post in the forum your answer to how long do you think it will take pharmacists to achieve provider status nationally, and why do you think that?